Hello, good evening. My name is Isha Chitroda, and I'm going to be presenting my RMS ORP2. So the case that we have here is a 10-year-old male child presents with swelling on the face, legs, scrotal area, and weakness. Basically, could show edema. And prior to this, 8 weeks ago, he had tonsillitis treatment, and he also had neutrophilia as well as proteinuria, hematuria, dark yellow colored urine. And the most important thing that we should look for is the anti-streptolysin O antibody titer levels, which were increased, as well as the C3 value that were decreased. And the patient was given diuretics and piperacillin tazobactams. So, what is the diagnosis? The diagnosis is acute post-streptococcal glomerulonephritis, and the reason why I said that anti-streptolysin O antibody was important because of this bacteria. So basically what happens here is that after this infection, normally after 2 weeks, you would have symptoms such as malaise, fever, edema, smoky urine because of hematuria and hypertension. You would also have proteinuria here. And this is normally after a streptococcal infection of the throat or the skin, and it leads to immunocomplex formation, as well as it increases the alternative pathway, so it increases the activation of the alternative pathway, and because of that, the C3 decreases. So the morphological changes you would see here in the normal microscope is how you would have hypercellular glomeruli because of neutrophils and monocytes because of the infection, and as well as you would have diffuse proliferative glomerulonephritis. In the immunofluorescence microscopy, you would see granular deposition, also the IgM and C3. And in the electron microscopy, you would see subepithelial humps or deposits. Now, piperacillin. Piperacillin is a group of drugs in the extended spectrum group of beta-lactams or penicillins that works on a specific type of gram-negative bacteria called Pseudomonas aeruginosa. Now, normally beta-lactamase, some bacteria may produce beta-lactamase, which breaks down beta-lactams, such as piperacillin. So if you give piperacillin with a beta-lactamase inhibitor, such as tazobactam, then it increases the effectiveness and also decreases the resistance of the bacteria to the drug itself. Now, we're going to talk about how probenecid works on penicillin. So normally, penicillin is secreted in the tubules of the kidney, but if you're given probenecid, at the same time, it decreases the tubular secretion, and it also decreases the volume of the distribution of penicillin. So the bacteria that causes this type of nephritis is Streptococcus pyogenes, because this is normally caused by a beta hemolytic group A cocci, which is Streptococcus pyogenes, and it is a gram-positive cocci, and the virulence factor here is mainly the most important one is M protein, which helps in adherence as well as attachment to the epithelium. There's also lipoteichoic acid as well as hyaluronic acid, which are other virulence factors for this bacteria. So these are my resources. Thank you very much.